Good morning, good afternoon, good evening to everyone. Thank you for joining us for this really very interesting panel where we have three amazing individuals joining us. Health innovation today is no longer defined only by scientific breakthroughs. It is defined by whether those breakthroughs reach people, are trusted by communities, and are sustainable for the planet. As we gather during New York Health Innovation Week, we are operating in a context shaped by three converging forces: a growing burden of chronic disease globally, rising scrutiny around equity, access, and affordability, and an urgent need to align health systems and planetary sustainability. In this environment, communications, public affairs, and policy advocacy are no longer support function. They are strategic levers. They shape how science is understood, how policy is influenced, and ultimately, how innovation translates into real world outcomes. Today, with leaders from Novo Nordisk, Medtronic, and MSD, we will explore a critical questions. Can communications and policy adequacy move us from innovation for markets to innovation for people and planet? With a core thought that from innovation as breakthrough, it is right time for us to look at innovation as impact shaped by narrative, policy, and trust. With that, let me first ask my fellow panelists to introduce themselves. There are some amazing people who have had an opportunity to work for a long period of time. And thank you, all three of you, to join me for this particular panel. So maybe I can start, Anushree, with your introduction, then Diwakar, and then Masooma.
Hi, thanks, Aman, and good morning, good afternoon, good evening, depending on which part of the world you're joining from. I'm Anushree Lakshminarayanan, and I'm from MSD India. Very happy to be here today, and I head strategic access, policy, and communications for MSD India. I'm looking forward to a very enriching conversation today and learning a lot from my fellow panelists as well. Aman, thank you so much for having me.
Thank you, Anushree. Diwakar.
Thank you. Thank you, Aman. Hello, everyone. This is Diwakar Mittal. I work for Novo Nordisk and I head their corporate affairs function for India. I'm really looking forward for this conversation today because, as Aman explained, policy shaping and media work together. They are at a very good stage here in India, and we have a lot to learn, and a lot has already happened. So, really, Aman, looking forward for this conversation.
Thank you, Diwakar. Masooma.
Hi, Aman, and hi, everyone. Thanks for having us here for such an important discussion. I think communications have really moved in the last so many years on this topic. To introduce myself, my name is Masooma. I lead communications for the strategic marketing enterprise for Medtronic across Eurasia. So I really work at the crux of marketing, commercial, and communications and policy together to really make things happen in this domain. So really looking forward to discussing and learning from all of you.
Thank you, Masooma. With that, my quick introduction, my name is Aman. I'm the managing partner with Finn for Health and Purpose Practice, responsible for Asia Pacific. So let me get started with the first question. We often hear health innovation for people and planet, but what does that really mean in real operational terms? So Diwakar, because Novo Nordisk has really been leading conversation on obesity and diabetes. So if may ask you, from your perspective, what does that really mean when we say health innovation for people and planet?
Thank you. Thank you for this very relevant question, Aman. In fact, in my view, in real sense, when we look at operationally, this primarily means developing our health system at a very fundamental level. In my view, it's also about developing products and partnerships which primarily improves patient health outcome and also reduces environmental impact. And I think what we have learned is we should do it simultaneously, not in a sequential manner. So I really see ESG not as a independent function, but ESG really being integrated into the businesses. And this we could do by better R&D, product designing, product which can improve outcomes, which can really work in low resource settings. For example, fewer hospital visits, reduce cold chain dependency, longer shelf life. I feel manufacturing and supply chain can also play an important role by integrating more and more renewable energy powered manufacturing, reducing water uses, which is so very critical, especially on access and equity. I feel we should reach out to more and more underserved people and really focus on affordable access through equity model. And most importantly, especially in our country like India, I really feel, and we have been doing it also, more and more focus on developing primary care, because this is where the large amount of people live. So primary care has to be strengthened. Generally, primary care is driven by the government, so the private sector is not that strong over there. So which means there is a potential to public private partnerships, especially when we talk about primary care, working with the government and really driving those innovations and those local programs. Last but not the least, I think when we talk about primary care, when we really talking about operationally strengthening the care as such, in, with inclusion of ESG, our advocacy, it should be focused largely around prevention. So it should be prevention focused healthcare system, which we should look for, so that inherently it is a bit more sustainable. So those are some of my thoughts if I have to respond to your point. Thank you.
Oh, no, thank you, Diwakar. And I think the space which No in the recent times has started to work in obesity, we can see its impact both from the societal as well as the environmental impact which is delivering. Let me bring in Masooma now, you into this conversation and think you coming from a medical technology side of it. How do you look at this space of innovation for planet and people?
Um, Thanks. Very good question because it's all about expanding reach, right? I think operationally for me, it means that we need to redesign the care in the system where technology travels to patient and not the patient traveling to technology. I think that is the crux of it. And that can happen with technology, definitely. So obviously, we do see AI and remote care and connected devices really kind of, trying to bring technology closer to people, and that's the way you expand reach. But the other side of it is also, is the system ready to take this? And that is where policy comes into picture. Are people and in the policy who are making the policies and also the whole pathway, are they aware about this, right? And that is where, again, the whole operational speed of getting the whole ecosystem together to make this happen is the most essential part, I feel. And when you talk about people and planet, uh, I, I like what Diwakar said, exactly what I also wanted to kind of bring up is this delivery of innovation. How fast is it happening? Are the clinicians able to make decisions faster? Is there reduced time of a patient in an hospital environment, which then eases the whole system? So from my perspective, when you think about patient and planet operationally, it is a two-way thing. One is technology travels to the patient, but you also ease off the pressure on the patient, on the system, in order to make this happen. And that's how you really build the efficient systems.
Yeah, and I think also what the point which you raised was the technology reaching the people or the innovation reaching. I think it's a very important aspect. If I'm not mistaken, there is some data which says that if the health systems reach the people and they don't need to reach to the big cities to get access to it, it reduces the carbon footprint, it reduces the fuel blueprint. So, while we may not look at it, but it has a huge impact on the environment per se. And I think so that's a very, very important point. So, Anushree, bringing you in here, how would you sort of refer to this particular topic of planet and people?
Yeah, thanks, Aman, for this question. And just building on what Masuma and Diwakar have shared, I think it's important to understand that when an innovator has brought a certain innovation, to life, I think discovery and regulatory approvals is just the starting point, right? Like we often think that once we have reached that level, I think the innovation is done, but I think that's just the starting point. And operationally, what this really means is Has the innovator thought about affordability? Has the innovator thought about delivery, system readiness, also some of the things that Masooma spoke about? Um, Also, has the innovator thought about manufacturing at scale? And what about supply resilience, for example, right? Like, have those aspects been thought about? I really like the point that Diwakar made on sustainability. I think in the coming days, what is the kind of carbon footprint that innovators are leaving behind? That's going to become a very critical aspect of this thinking. So I think net approval is just the starting point, but how quickly, who all benefit, and at what systemic cost, those are critical decision points in operationally bringing an innovation to life. I also think, Aman, that no single actor can really do this alone. I think what is really needed are deep partnerships to bring some sustainable innovations to life. So, for example, governments and they play a very important role. Multilateral organizations play an extremely important role, and of course, at the heart of this is the innovator itself, and which we've already discussed. They play an important role. So, partnerships, needless to say, they begin very early in the life stage, and around disease burden, what are the prevention goals for the government, where do the gaps lie? So those are some of the aspects that the uh, it has to be thought of as a collective. And lastly, I think again something we often talk about it, but is there scale and durability, right? Like, that is an
Hmm.
important aspect. And when a breakthrough that reaches, let's say, thousands, it is meaningful. But I guess when it reaches millions, it is sustainably, then it becomes transformative. So I think that is an important aspect to be kept in mind. So I think, in summary, I would say that designing science with access in mind is super important. Advocating for policy, again, with system outcomes is very integral. And that's where, like Masuma said, that comms and policy advocates come into the picture.
No, thank you, Anushree. And I think what I heard from all three of you is, and which we know, that health ecosystem is not a linear pathway. It's a interconnected ecosystem of different stakeholders, and each stakeholders having their own role to play. So from a payers to patient groups to pharma, medtech, policy, regulators. And therefore, if we need to really look at it, it's not just about product innovation. And I think what Anisha said, we have to develop a system level impact, right? How are we really taking that innovation to bring in a measurable impact in the life of the large communities? Because then the innovation is really bringing the impact both for people and the planet. So extending from there, the next I think would be, and Anusha, I just want to start from you, where do you see communication and policy advocacy genuinely shaping outcomes? It's not just about awareness, but access, adoption, and regulation, because we would like people to, and we all sort of work together. So we know the awareness exists, but we want that awareness to move from intent to action at across stakeholder groups. So, how do you see that comms and policy advocacy, shaping those outcomes?
Uh, it's a very important question, Aman, and I think right at the start in your introduction, you did lay the ground that policy and communications are no longer an afterthought, functions.
Exactly.
In fact, they are very integral to a CEO's, strategy. So I think if we look carefully, we'll see that there are several moments and several examples, both in India as well as globally, where we can see that policy and communications have played a very important role in moving the needle. If I can just take a very recent and an important India example, and let's say it's on the India's vaccine ecosystem, right? Now,
Yeah.
for years, of course, innovation has existed. Scale and trust was somewhere missing, but I think what changed thanks to sustained advocacy by industry, public health experts, as well as government joining hands, is that the whole conversation has moved away from vaccines just being commercial products to being very integral part of the national health infrastructure, right? So I think that's an important change that has happened. And policy decisions actually linked to, for example, local manufacturing, procurement, inclusion in the national program, all of those have come into effect because of a very sustained policy advocacy efforts by all the players and actors, that I just spoke about. I think, and another important example where I think policy advocacy has played an important role would be Ayushman Bharat. Again, very specific to India, Aman, but the very expansion of Ayushman Bharat to including tertiary care, or let's say oncology, or let's say digital health, it did not happen because of some sort of isolated lobbying by one or two players. It came through because there was an ongoing dialogue that was going on between the government, between providers, insurers, industry, and it was backed and supported by a lot of data and science. um, and I think that coalition approach, it really helped to turn a scheme into a very big platform and driving real adoption, at scale. So I think those are a couple of examples. Again, globally, there is one on HIV. Once again, we know that there has been coordinated advocacy efforts by industry, government, civil society. All of them have come into picture, and I'm sure Masooma would, agree with me on this one. But none of this can work in the absence of, credible communications. So comms really acts as that bridge between science, policy, and society. And again, HPV vaccination in India, let's, very, very recent example. For years, that scientific evidence existed, but uptake was really lacking, right? And what happened is, thanks to communications, this has shifted, right? We've been able to change this narrative to cancer prevention, women's health, national priority. All of those things have come together, and it's all credit to really concerted effort by communicators. So I'll stop there, but I think broadly this is how policy and comms can really shape the ecosystem.
No, no, thank you, Anushree. And I think the point which out about the vaccine, and personally, I've been working in this space since 2001 when the first time started working with Merck discussing the HIV/AIDS vaccine in phase 2 trial. And the whole idea was that how do we make policymakers understand vaccines as not as a cost, but as an insurance for the better future. So it is something, and that is, I think, happened. I think so. Therefore, the point which you raised is the role of communication in shaping the narrative to perception to people to then looking at the world in a different way has happened. It took time, but it has happened. And therein, I want to bring Diwakar you into here because you are looking at a next big public health issue right now, which is the obesity right now. And to some extent, in the last, I would say, 5 to 6 years, the conversation has changed. So how do you look at communication and policy advocacy shaping the health outcomes?
Yeah, a very relevant point, especially for our department. So, as I said in the beginning, we have to keep a patient at the center. We call it patient centricity. And when we do that, we realize that there's a journey which every person, let's say with non-communicable disease, because this is where we operate largely, they go through a full journey, whether it is awareness, treatment, adherence to therapy, or late, complication, etc. So when we look at the any com work or any policy shaping work, primarily it needs to address that journey in its completeness, actually. And when you like to do that, we see that the narrative becomes a bit more compelling. And second thing, which is very important, is to bring a coalition in terms of advocacy. As Anushree spoke, I believe that it's not just one company or one person can do this. You need many actors into the whole ecosystem. In fact, one example in our country, which is very close to my heart, is the polio eradication. In fact, when
Yes.
India became independent, we had a huge issue about polio. I mean, if you see our old movies, there used to be that, that person died because of polio and all that. But if you could see a trust building communication, community led communication, how it has led to mobilization of large part of India. And today, India is polio free. So, of course, it has taken time because it's also a large country. But how the community led interaction has really worked from from a communication to a full policy change, and so much so now we don't have polio in our country. And we have also seen during COVID time, where a little bit of hesitancy in the beginning and then the fast track regulation of vaccination. So that has also happened in the similar way. If you look at obesity, where we are working very actively, first is to really understand that it is not just a lifestyle issue. It is a chronic disease which needs to be recognized, and this is where a lot of work needs to happen, and this is where a lot of work is happening in our country. And this is where the coalition or the partnership with the Ministry of Health, clinicians, digital health partners, payers, all this is happening in our country with a view that obesity to be recognized as a disease and to be part of a national program. So those are some of the examples which are good examples in our country, which we have seen, Aman, in last so many years, which also drives us and motivates us to when we look at things like obesity for future in this country. Thank you.
No, thank you, Diwakar. So, Masooma, from your perspective, how you as an individual have seen the communication policy advocacy shaping the outcomes?
No, thank you very much, Aman. I think Anushree and Diwakar have put it so rightly with so many examples, right? I think the crux of it is that communications and policy, we are not just talking about narrative here. The evidence is not replacing the narrative. What we are saying that communications actually plays a role in getting the evidence to the right people, people who decide the future, people who take a decision on what should be reimbursed, right? And that is what we do. And we have seen that. Like, very recent example I can talk about is the whole stroke therapy being reimbursed by the state of Punjab, right?
Yes.
We have, I mean, in terms of NCDs, whenever you ask a common person about an NCD, they will always end up talking about, say, cardiac arrest or heart attack, as they would normally call it. But we all know that stroke actually tops that chart in many ways.
Yes.
But it is still not reimbursed. And see, we don't have a magic wand. We all know it's a journey. It takes years together because we're talking about really shaping an ecosystem. And that is where communications have played such an important role in what Anushree spoke about with the vaccines, or what Diwakar just spoke about with polio. And what I'm just talking about, stroke. We've really seen the change with Punjab just reimbursing, and now other states also talking about reimbursing stroke as for treatment. So the whole crux here is that we do the job of getting the evidence to the right people, plus we do the job of actually impacting the scale by talking the language, what the policymakers understand, what the patient understand in terms of awareness, and what the whole ecosystem and stakeholder understand. So I think over the last 5 years that I have been here in this industry, I've really seen comms and policy, government affairs kind of working together in building this whole pathway of really making people understand that you put your money where it matters, to your own population, to your own people. And I think that's how I would put it.
No, thank you, Masooma. And I think and I personally agree with this, that what all you said, that the power of uh, shaping narratives or shaping the external public health ecosystem is something which needs to be understood and further empowered by the organization, because that is one thing which is only going to become much more relevant. And I think that brings to the next kind of question, which is the whole era of misinformation disinformation and rumors. I remember when COVID happened, we were working with WHO because the amount of this whole thing was happening during COVID time was so huge. And this is a phenomenon of post-COVID. It's not something which we saw in that part. So the other role which I think all of us have to play is how do we ensure credibility while we advancing complex health innovation in today's world where there is this whole era of misinformation. So Masuma, if I could ask you in terms of how do you as a communicator look at this, and then I can ask the others.
I think credibility is so important to all of us, right? I mean, that's our core job. Nothing can take away whatever we do. It all comes down to trust and credibility. That's what our bread and butter is. And that comes through consistency, clarity, and transparency in terms of, whether it is data, whether it is consistently working on a topic, and whether it is really working as an ecosystem. So I think one of the most important thing is to really make complex things simple, not just for the patient, but also for the overall clinicians and the ecosystem also. Secondly, at the end of the day, the clinicians are the one that a patient would trust, right? And it's very essential that there is a full care pathway and an education pathway that happens with the clinicians who are working on these, on different NCDs and really working on the therapy areas. So I feel it's not just trust that we built alone. It's a trust of the ecosystem. And that is where we play such an important role, because we as communicators bring that clarity and that consistency in our messaging, and we bring that transparency to the audiences that we are talking to, whether it's a patient or whether it's anyone. I mean, I also agree with you with the whole digital world of things. There's a lot happening. I'm sure Anushree and Diwakar would relate to this. I mean, the amount of misinformation that digital channels have and what we have to tackle on a daily basis is unbelievable, right? But this is where we have to be on our toes. We have to keep listening what's happening. We have to keep responding. We have to correct the misinformation then and there. And that onus lies on the whole ecosystem, on the brands, and also on the HCPs. It's not just one person. I think the trust is a shared, I would say, a shared KPI. I would say actually for the whole industry at large.
Yes, Vasuman. I think in the recent times, I've been working with my colleagues in the US on the whole media forensics part of it, because it's not just about listening through the tools, but also who are these bad actors? Because you have bots nowadays, which you can't even identify, who create conversations and shape the ship. And therefore, understanding the intent behind anything and who are these people or bots becomes very, very important. So part you said the listening, but a very deeper listening, even including into the dark web, becomes a very important part of it. So Diwakar, if I can bring you in here, how do you see it? Because you have seen this happening in the recent past of misinformation.
Yeah. So, it's a process, Aman, if I have to say this. And again, I will go back to, for the sake of just repeatedness, understanding the lives who are suffering, patients. There are pain points which they go through. So when we genuinely make effort at individual level or even as an organization to understand those pain points, create solutions those pain points together with them, together with community, what it does is it does bring trust. Now it's a slow moving long term process. So one is to build that trust with the healthcare provider, with the patients, with the communities, that you are there to resolve something, you are there to do a solution actually. And second part is which is very important. For example, when we are working with the patients, most of the time in chronic diseases there are stigmas attached. For example, with obesity or with diabetes, there are different stigma which people who are suffering with them, they go through it. First is to recognize that stigma actually. We can't say, this doesn't happen like this. So we have to normalize what they're going through. So because that's a big issue which many times patients they go through. And once you normalize, once you listen to them, once the stigma which they go through becomes a conversation, I've seen it slowly and steadily tends to go away. They tend to open up. Otherwise, there is always a feeling that I have not been heard. You know, and these are long-term issues, especially in chronic care. And I would say, at last, also be responsible in terms of your storytelling, in terms of your processes, in terms of what you offer actually to the healthcare professionals, to the patients in general actually. So that's also setting up the right expectation. Again, is a very important, because as I said, it's a slow moving process when we work in healthcare actually. So these are some of my thoughts which I can share.
Well, thank you, Diwakar. Anushree, because this is a challenge which, especially for you, have faced in the recent times. So how do you look at the misinformation being managed?
Yeah. Aman, this topic is really close to all our hearts. And as I was listening to Masooma speak, I thought that maybe a session needs to be dedicated, only to upfront discussing misinformation and what can policy, shapers as well as communicators really do to really solve this. So
Happy to host a separate channel with
yeah.
the person who I know having the system for this.
Okay, great. So, I want to upfront start by saying, Aman, that uh, I think misinformation is here to stay, right? It's going nowhere. It's,
Yeah.
I think, only going to become more and more
Yes.
complicated. Some of the examples you gave of deep fake and all of that is just going to become worse. So therefore, then the question is, so what do we do, right? And I think the antidote to this misinformation is really uh, is demonstrated through behavior, and it is consistent behavior. And I know that Masuma used that word consistency. So I think it is behavior partnerships demonstrated time after time after time by innovators, by industry as such, right? I think it's also important for us to know that it never happens that one company or one institution loses credibility. When one person in a certain sector does something that beats the trust, the sector stands to lose, right? So I think that's important to understand that everybody needs to do that, and then everyone needs to uphold very high standards of evidence, transparency, conduct, all of those things. I think we need to know that we shouldn't be overstating benefits. And I know that Diwakar, for example, spoke about patient benefits and patient engagement and all of that. So we shouldn't be overstating the benefits, and at the same time we should also not understate the uncertainty. So I think that's also important. And let's not get defensive when misinformation happens. And I know it's easier said than done, but we keep telling ourselves that we shouldn't get defensive. um, I think sometimes it also matters on who the messenger is, right? And we've often heard this thing that shoot the messenger and kill the messenger. So sometimes companies need to understand that we may not be the best place to deliver a certain message. So who is that credible institution or body that's actually partnering with us? It could be sometimes multilateral organizations, it could be government. So we have to understand who the messenger is. And I think, again, one of the important things of building trust is really how localized is the communication, right? Like sometimes it can go, we think that one size, one message fits all may not happen. So we need to really customize. And I think, lastly, ethical guardrails in global communications need to be very high. We have to make a very clear separation on what is promotion, what is education. And I know, and I, like, that India is doing a lot in that space, right, on how we communicate, and the language we use is that promotion and transparency and overall, so I think that is what I would say. So I think we have to become comfortable with it, we have to be prepared, and we have to always anticipate that this is going to happen, right? So yeah.
Well, thank you, Anushree. So let me, by just sort of end by saying that when we started with this topic, what I really heard is that if you look at health innovation, it will not be defined by what we just invent, but also about what we enable, who we reach, and how responsibly we act. And as individuals, as this professional, we are at the center of that journey that sits at the intersection of communications, policy, and building trust. I think that's the kind of the core. With that, let me thank you, all three of you, for your valuable time. It was really exciting and interesting and insightful. And I hope the viewers really find some of the thoughts which emerged of use. So with that, thanks a lot to all three of you, and I hope we can do more of these things in the coming year.
Thank
Thank
you,
Thank
you very
you.
Aman.
much. Thank you, Aman, for
Thank
bringing
you,
us together.
everyone.
Thank you.
Thank you.